Good evening, everyone. I'm really thrilled you could all join us tonight for the 10th anniversary Max Gray Salon. 10 years we've been doing this hard work together. I'm so proud. I have no words. And I have Lucas up here to help us tonight because we all need a little bit of extra love. And thank you to our animal pet connection. I know many of us are still recovering from the devastating wildfires, and it really means the world to me that all of you came out tonight to support us. I'm overwhelmed. I can't believe we've been doing this important work for 10 years, and we've helped so many people. Thank you. Thank you so much. Tonight we have with us Max's best friend, our friend, our friends, our family, our UCLA family, everyone here, everyone's touched by mental health. Means the world that we're all here together to support each other and help support this important work. So thank you. The difference that our fellows make in the lives of children and adults every day is nothing short of remarkable. Our fellows come to us, this amazing group of doctors who you'll meet again shortly, come to us from some of the most impressive medical schools and doctoral programs in the US and go on to serve communities in Southern California and across the nation. Please know that your generosity makes all of these efforts possible. I'm so grateful to all of you and to Charlie and Stephen for all of their support and to everyone for coming out tonight. I know how hard it is to come out at night to at 5 o'clock to come to UCLA, but thank you and for showing up tonight and every year and everything you do to support us. We couldn't be more grateful. I'd like to give a special thanks to the UCLA leaders who have joined us here tonight. Jonice Spiso, CEO of the UCLA Hospital System and president of UCLA Health. Dr. Stephen Dubonnet, Dean of the David Geffen School of Medicine, who is here for the reception. And I didn't see Dr. Hansen. Was she here? Maybe, I didn't see her. Okay, so then I'd like to thank Dr. John Mazziata, to thank John Mazziata, CEO of UCLA Health and Vice Chancellor of the UCLA Health Sciences, and welcome him to the stage to say a few words.
Don't leave.
Don't leave, okay. I'm gonna hang out here with Lucas.
Yeah, you stay with Lucas. Keep him away from me. Good bite. Yeah. No, he's a good boy. See, she has treats. I didn't bring any treats, so big disadvantage. Oh, well, thank you, Lori, and thank you all for joining us here tonight. As Lori said, it's it's not that easy to get to Westwood and make the special effort, but we know what this means to you and why you're here, and that's important to us, especially tonight, the 10th anniversary event for this program. So round of applause for Lori and Steve. And I would just say that the profound effect of the Max Gray Fellowship Program at UCLA is initiated by Lori with Steve and has had just an unbelievable impact on our ability to deliver more care and better care for people with mental health disorders in our UCLA health system. So it really has made an amazing impact, and it's demonstration that your philanthropic leadership demonstrates the power of an individual effort. So an individual in our world can have an enormous effect, changing the lives of so many people because it's amplified through the fellows and the fellows who train other fellows, and it goes on and on. So it starts with one person, but it goes a long way. So we're immensely grateful for your partnership in this effort and the participation of all of you. So now I'm going to tell you some statistics about this program. So the Max Gray Fund for the Treatment of Mood Disorders has significantly expanded our capacity to serve patients and families. You see that graph and how it goes up. The fund has provided resources for 36 fellowships over the past 10 years. So you can see that this upward trajectory continues as you see it on the screen. And since its inception, the capacity and provider capabilities have grown rapidly. So in 2016, the first year of the program, patient encounters numbered 113. Today, 10 years later, that number is 582, representing just very impressive growth in the number of people we can help. In 2016, 2 fellows helped expand patients' visits by roughly 57 encounters each. But that figure today is 97. So a 200% increase in the number of fellows since 2016 and a 415% rise in patient encounters. So that's a lot of additional people who have received services and been helped, both the patients and their families. Okay, I'll be able to separate these 2 pages in a moment. So obviously the program is an enormous success, and it's due in no small part to the leadership and generosity of Steve and Lori, but also to the participation of all of you here tonight and others who couldn't be here tonight, but have made a commitment and provided generous support for all the things that this program does. And I know we're gratified by these outcomes, but knowing Lori, not satisfied with these outcomes. So I'm sure she will work even harder in the years to come as this continues to grow because of what it means and how many people it helps. So on behalf of all of UCLA Health, thank you for your support. And thank you, Lori and Steve, for your leadership. And so back to Lori, and you're down to no more treats. That's your last one. So.
Thank you, Dr. Mazziata. Oh, Lucas. We need a dog. Everyone needs a dog or 2. As I mentioned earlier, alumni from our Max Gray Fellowship can be found across the country, but we're really fortunate that many continue to work here in the LA area. And I must say, we really hit the jackpot when our next speaker, Dr. Arthur Gillis, chose to stay in this community. Dr. Gillis is an assistant professor of the UCLA Division of Child and Adolescent Psychiatry. She is the inaugural holder of the Resnick Neuropsychiatric Hospital Board Term Chair in hospital psychiatry, and she directs the child and adolescent inpatient unit at Resnick, a very challenging job. She earned her PhD in bioengineering from Texas A&M and then decided she wanted to go to med school. She graduated from UC Davis. Following her residency training at Davis, she completed fellowships in child and adolescent psychiatry and forensic psychiatry at UCLA. She then served as a Max Gray Fellow from 2018 to 2020. Dr. Gillis specializes in evaluating and treating traumatized children and in identifying mental, intellectual, learning, and developmental disabilities in justice-involved youth. Her research focuses on developmental cascades and early intervention after early life adversity. She also spent several years working in mental health care for medical trainees and house staff. And she continues to provide care for trainees, physicians, and house staff. Artha is a warm, compassionate, wonderful person and talented physician and researcher. And UCLA could not be luckier to have her as faculty. I would now like to invite her to the stage to tell you about her work and what the Max Gray Fellowship has meant to her.
Thank you so much for the introduction, Lori. And I feel honored to speak as a former Max Gray Fellow. Because anniversaries offer a profound opportunity for reflection, in preparing to speak about my experience as a Max Gray Fellow, I thought a lot about the journey that brought me to UCLA. I reflected on my upbringing by two parents who grew up in a segregated rural Southeast town in Texas and who came of age during the Civil Rights Movement. They instilled values of education, excellence, and advocacy in me and my siblings as they raised us in an integrated neighborhood in Dallas, Texas. After we moved to San Antonio during my adolescence, I recalled my father, who was a minister in the Southern Baptist Church, speaking on behalf of those who could not access the quality of education that my sisters and I received and who did not have a pathway out of impoverishment despite working full-time. Not only could members of the church not access education or sufficient financial means, as Black Christians, they were encouraged not to seek professional help for chronic medical conditions. And there was no such thing as a mood disorder. I wouldn't even hear such a term until I began medical school. Ironically, I had the sense, even as a young child, that some people's brains work differently. The tyranny of untreated psychosis was indelibly imprinted on my young mind after seeing a man who I knew to be the son of a well-respected couple in our church roam the streets of our neighborhood in Dallas, yelling to no one or someone. He arrived at church one Sunday only to be disappeared. Despite the focus on education, excellence, and advocacy, becoming a psychiatrist was the last thing my family expected of me. However, because I was always curious about the suffering of others, it's clear to me that my curiosity about the human brain and the development of mental suffering has been the through line of my story. This curiosity persisted even as I earned degrees in mathematics and in biomedical engineering, as Lori mentioned. Even as I studied the use of lasers in vitro fertilization, I found myself curious about the struggles of the couples who sought to start a family this way. The mathematical modeling was the easy part. It wasn't until I had completed my PhD in biomedical engineering that I paused my education long enough to reflect and to plan my career. Although ironically, I hadn't considered medical training when it was presented as an option several years earlier, when I considered that this training would allow me to study the human brain and possible interventions to alleviate mental suffering, having to dissect a human cadaver did not seem quite so insurmountable. After completing my medical degree in psychiatry residency at UC Davis, I came to UCLA to train in child and adolescent psychiatry, psychiatric research, and forensic psychiatry. While completing a fellowship in forensic psychiatry, I began to work on both sides of the criminal legal system. On one hand, evaluating youth detained in juvenile hall, who mostly never had access to psychiatric evaluation or treatment, and on the other hand, working with survivors of sexual abuse and assault at the UCLA Rape Treatment Center. The ability to remain engaged in work important to me while pursuing research drove my decision to continue working at UCLA after I finished training. Little did I understand then how training as a Max Gray Fellow would inform this work. I have found that training as a Max Gray Fellow helped me build a foundation of knowledge and a nurturing environment and facilitated my early growth as a psychiatrist. Because mood disorders take years to emerge, having the opportunity to follow patients for several years through high-risk periods of adolescence and observe the possible impact of substance use in mimicking or masking mood disorders is critical in refining diagnostic skills. The experience I gained in the 2 years I trained in this faculty incubator under the guidance of seasoned faculty and pioneers in the field has informed every role in which I've served since then, including as the medical director of the Child and Adolescent Inpatient Unit at Resnick. To be entrusted with leading staff on the inpatient unit who once trained me speaks volumes about the excellent training I received here. The Max Gray Fellowship is a critical illustration of this tradition of excellence in training psychologists and psychiatrists to provide the very best care to patients in the diverse communities we serve in Los Angeles. I am grateful for your vision, Lori, and I'm grateful for everyone who has contributed to the funding of this program over the past 10 years. You have contributed directly, not just to my career, but to the care of the patients and clients I have evaluated and treated while training as a Max Gray Fellow and since transitioning onto faculty. Thank you.
Wow. Aren't we lucky to have Artha stay in our community? Artha's husband is here with us tonight, and thank you for everything you do in our community. I would now like to move into this evening's discussion with our Max Gray Fellows. We did not have a Max Gray Fellow in the Adult Mood Disorders Clinic this year, but I know Dr. Gitlin is working really hard to find one for next year. We are really fortunate to have back this year the same cohort of Max Gray Fellows that we had last year. And they're here with us tonight, as are their families, their partners, their children. It really means so much that everyone made the effort to come out and support them. The work they do is invaluable in our community, and I'm really proud of them. With that, I'd like to invite them to the stage. Doctors Gregory Barnett, Jesse Burns, Megan Ichinose, Manal Khan, and Jenny Nguyen. Everybody needs a therapy dog. Okay, all right, sorry. Okay, this is distracting. Okay, you can have them. Thank you. Okay. Because you've gotten to know our fellows, that they were all here last year, I'd like to start with a brief update about the work they've been doing since we last came together. Megan, as our most senior fellow and the mother of a new little girl, Serena, who I had the pleasure of holding earlier today. Okay. Okay, I think it's time, Lucas. Thank you. We can't steal the show. We have to highlight our doctors. Thank you. As the new mother of that beautiful little girl, how has your work changed across the fellowship?
First, I just want to say I'm so grateful to be able to be back for another year. It's been a real privilege. And it's been great, I guess, across the fellowship to go from a trainee to now a supervisor, where I get to train other co-fellows who are more new, I guess, to the fellowship, as well as psychiatry residents and psychology interns and other therapists who are in training in our clinic in individual therapy and family-focused therapy, as well as in our diagnostic evaluations. And then in terms of the last year, I've been really fortunate to work on two of our big research projects at CHAMP right now, one being a study examining how psilocybin may enhance cognitive behavioral therapy for adults with depression. I serve as a therapist on that trial. And then another study where we're looking at a new intervention, a ketogenic therapy diet for youth with bipolar disorder.
Wow, that's fascinating. Greg, you're also a long-term fellow. Would you tell us about your experience? What your experience has been like following patients over a course of a number of years?
Yeah, so the long-term care that I've been able to give to my patients has been my favorite part about being a fellow. I believe it's been 4 years now, and I've been able to see them grow and develop. I've had a number of patients that have gone off to college, and I've been able to see them thrive.
Do you hear back from them after they've gone?
Occasionally I'll hear back. I'll have a parent that'll reach out and just send me an update about how they're doing. And that's honestly my favorite part of my job. That's what I think fills up my cup and keeps me going, is seeing the progress that goes from an initial evaluation where someone comes in with a host of issues that they want to try to improve upon, and be able to kind of help them reach their goal, achieve the things that they want in their lives.
And you're a psychiatrist and you prescribe medication and do therapy.
That's right. And that's a really privileged position to be in as a fellow, is being able to do therapy in this clinic. In a lot of places, medication management tends to be the kind of path for a lot of psychiatrists, but therapy is a passion of mine. I've been able to do that here, and it also allowed me to also participate as an evaluator in the psilocybin study with Dr. Uchinose.
Oh, that's terrific. Manal, I know you've been really busy this year with those two giant kiddos you have. And the clinical work, research and teaching. Can you give us an update?
Absolutely. And thank you so much for being here and taking out the time from your evening and supporting us. With regards to, yes, it has been a busy and productive year. So through Max Gray Fellowship, I've continued to care for patients, both new and also those who I have established relationship with at this point. I'm also the Associate Program Director for our Child and Adolescent Psychiatry Fellowship, which is also in the process of growing. So we are going to go from 15 to 21 trainees, which is an exciting development. I also work on the inpatient unit with the wonderful Dr. Gillis and Dr. Gwen. So that has kept me busy. And lastly, with regards to research, I think our project is now in the final stages of its approval, and it is about studying the parenting practices, including challenges, concerns, and strengths of South Asian immigrant parents, and seeing what are the influences from an intergenerational parenting perspective, cultural orientation, and immigration on their parenting.
Wow. Okay, Jenny. In addition to the Max Gray Fellowship, you work with some of the sickest kids in the hospital. Will you tell us about your work in the past year?
Yes. Hello.
Yeah.
Yes, Lori, and I'm also appreciative of the opportunity to return this year, and thank you everyone for coming out tonight. In addition to my service as a Max Gray Fellow, where I work with kids to evaluate for mood disorder, manage medication, and do therapy similar to Gray, I serve as an attending psychiatrist on our child's inpatient unit here at UCLA, where I work with an interdisciplinary team to treat kids who come into the hospital for various reasons, including a suicide attempt, aggressions, or conditions that cannot be managed at home. I also am working on research in suicide prevention and am currently working to implement evidence-based practices and safety planning into our acute care settings. And my newest endeavor is helping to build out the psychiatric services at UCLA Santa Monica Emergency Department.
That's fantastic, Jenny. I don't know how you do that with that beautiful little boy at home as well. All right, last but not least, let's hear from Jesse. Your expertise began in neuropsychiatric testing, but now you've broadened your skill set in individual and family therapy. Can you tell us about how you're able to do each of those at Max Gray Champ?
Yeah, absolutely. I mean, also echo what everyone said here. Thank you all for being here. I'm extremely grateful to be here as well. Yeah, I feel really fortunate. Typically, my neuropsych background has kept me in more of an assessor or an evaluator role, aka the one recommending individual therapy or family therapy to my patients. So then to get to be on the treatment side, as the provider giving those interventions, I feel like has given me a more holistic understanding, not only of what I'm recommending, but what these patients are having to do, the hard work that they're having to approach, given whatever concern they're struggling with. So that's one piece. I'm getting to do individual and family therapy, learning from some of the greatest supervisors and pioneers in the field, and getting to collaborate with psychiatrists and other psychologists and learn from them on a weekly basis on some very complex cases, and getting to be on again, like doing the psychodiagnostic evals with these patients and then following them through treatment, that's a really special opportunity to get to do both of those. So, and lastly, I'm working with Dr. Walshaw, who is my neuropsych supervisor, to develop the neuropsych battery for the study that's looking at ketogenic diet and the effects that that can have with bipolar disorder. So grateful to combine both.
Wow, what a terrific group of fellows. After the challenging start to 2025, we shifted gears and decided to focus this panel on stress and how to adapt and thrive despite it. I'd like to take a moment to reflect on what kids are facing today in the Max Gray Champ program and what they've experienced in the last 5 years. These kids have been through COVID and wildfires. These kids live with fear of school shootings. The political climate is extremely tense and unsettling, and they feel its effects. I don't know if it's ever been more difficult to go to school. All of this and more is why I'm thankful for the people on this stage. Our Max Gray Fellows show up every day and do this hard work to address these issues and to help the kids and their families overcome such adversity. Let's get into some questions. Manal, we'll start with you. As we continue to rebuild after the January wildfires, I'm wondering, how should a parent talk to their child about traumatic and challenging events? Is it any different for a teenager who has more exposure to social media and the news?
Yeah, absolutely. This is a very timely and relevant question. I think it is important for parents to have open, honest, and age-appropriate conversations with their children. I think when we say age-appropriate, what we mean is that if you have a younger child, you might want to limit their access or exposure to media. And if you have an older child, you might want to empower them to identify misleading information and to disengage with emotionally charged content. So you would want to pass down that media literacy to them. With regards to
Could you say that slowly so we could all understand that?
Yes, absolutely, absolutely.
Fast.
So if you have like a younger
Give
child,
us an example.
so if you have a younger child, like limiting the amount of news that is playing in the background
Yes.
and the exposure that they have to these very charged conversations. If you have an older child, helping them identify which are credible sources, which are sources that are misleading and spreading misinformation. And then also not engaging with a lot of emotionally charged content because, you know, our social media feeds will start to curate themselves based on what we give attention to. So being very mindful about that. However, regardless, for everyone, I think it is important for parents to encourage dialogue, to validate their feelings, to provide factual and factual information, and then to continue the activities that you would otherwise continue, maintain routines. You would also want to empower your older children to take on some advocacy or take on some volunteering roles so that their, that sense of agency is kind of restored, because that is, sometimes traumatic or stressful situations take away our sense of agency, and that is a way to kind of restore that agency as well.
Oh, that's really helpful. Thank you, Manal. Jesse, separate from the recent fires, what are the common sources of stress for kids and teens with mood disorders? And how are these stressors addressed in our Max Gray clinic?
Yeah, I mean, as if it's not already hard enough to be a teenager. Kids with mood disorders particularly have more nuanced layers of stress. Academically, these kids can fall behind if they're having to participate in treatment or a treatment program that's more intensive. Socially, they may have or feel like have thoughts about being different. Why do I have to take these meds? Why do I have to go to this treatment? My friends don't. Family conflict can increase, particularly during mood episodes or leading up to them. And a lot of times these kids are also worried about, when is the next mood episode going to happen? When am I going to become manic? Or if I am feeling manic or high or more elevated, when am I going to get depressed? And so these kids are managing all of this on top of the kind of typical developmental stress at this age. So in terms of how we address them, first and foremost, just normalizing what they're experiencing, that this is really common for kids with mood disorders to have these types of thoughts and feelings so that they feel less alone, and then collaborating with the patient and with the family on how do we address this? Is this going to be, for academic stress, talking to the school psychologist, developing an educational accommodation plan so that if medications are making you tired in the morning, let's have you start later in the day. Practical things like that to reduce stress. And then other coping strategies like mindfulness or a coping box, things like that.
Wait,
can
what
help.
is a coping box?
Yeah, I actually just made one with a patient last week where, it's literally something that they can carry in their backpack, their lunchbox, where it has fuzzy socks or something that, a perfume or a smell that can be grounding to them, that's comforting, their favorite snack, things like that. That's just literally something they can pull out in the moment to help them ground, remind them of where they are and bring them kind of out of that moment of panic or anxiety. So those are the things that we talk about and develop collaboratively. We want it to really be a team-based approach where the patient is taking, like Dr. Khan said, agency, so that they're implementing this, because we're not with them for most of the week. They're with us for an hour, but they're having to do this on their own outside of that. So
That's terrific. Greg, what does therapy look like in our Max Gray Champ program? Do therapists explore early childhood experiences or adversities, or are they more focused on the present?
So the look of therapy depends on what the presentation is. Fortunately at Champ, we're able to provide both individual therapy and focused family therapy. And when our patients are teens and kids, oftentimes that family component can be extremely important in terms
Do
of.
you do this in person or on?
Yeah, well, because of COVID, it really opened up telehealth. And so we have a number of families who, just out of convenience, prefer to do things over Zoom. But we also do offer in-person therapy and evaluations, just because for some, that in-person component, that we call it the holding environment of the therapeutic space, can make a huge difference in their engagement. And so besides the family therapy, individual therapy can also look a little different depending on the person. So a lot of the teens I see are dealing with either depression or anxiety. We do talk about coping skills, but I also do take a bit more of a what's called a psychodynamic approach, where there is some exploration around their social connections, their home environment, kind of what kind of experiences maybe they had in the past that are impacting how they're experiencing their lives now. So it's a kind of some of it's trial and error, just trying to figure out what's going to be helpful for the individual.
That's very interesting. Megan, Jesse touched on coping skills. What are some healthy ways of coping with stress, anxiety, or trauma? Help us.
I think when I sit down with a client or patient and talk about coping, we want to get a sense of what aspects of the stressor or stressors they're facing are in their control and what aspects are really out of their control. And that might kind of dictate what types of skills I encourage. So for things that are in their control, or even aspects of a stressor that's in someone's control, it may be helpful to problem solve, generate some solutions collaboratively, and put together a plan and how they can take baby steps towards facing that stressor. That's something we definitely do with folks who have anxiety, because instead of avoiding the stressor, which can exacerbate the cycle of anxiety and reinforce it, we want people to slowly expose themselves to things that might cause anxiety and thereby reduce stress. For stressors that are out of our control, which has been really the case since the new year, we often turn to more emotion-focused coping, which is ways to regulate our own emotional reactions to things. And so that might include relaxation skills, ways to relax our body and mind, like mindfulness or deep breathing, body work, where we reduce tension. It might include talking to peers or close friends and family to get that social support. It might include just really focusing on maintaining healthy daily routines, like good sleep, exercise, getting outside, getting into nature, eating nutritious meals regularly. It might also include, we do this a lot in therapy, but reframing situations in a more helpful way. So thinking about things in a way that can be more positive or more helpful, when oftentimes we're consumed by stress, we have a more negative lens around things.
Could you give us an example of that?
Yeah, I think, we have a tendency, maybe if something bad happens, that it's always going to be this way. And that can lead to thoughts of helplessness or hopelessness about the future. And so if we can kind of provide maybe a more neutral or positive reframe that things might get better, or there's certain things I can do to help the situation, that might help us, adjust or regulate our own emotional reaction in that situation. And then I think other coping skills, I'm trying to think, we have a lot that are around mindfulness and meditation, which is more of acceptance of just noticing what's coming up and letting it be there, not trying to push it away. And that's really tough to do, but it's, I think, a skill that a lot of our teens really benefit from, and adults too, in managing these
terrific.
uncontrollable stressors.
Yeah, so now I'm going to go to Jenny and ask you to talk about mindfulness and explain how it might be helpful.
So mindfulness is a state of awareness where one is focused on being in the present moment without judgment of oneself or others. Mindfulness can be helpful in coping with stress by helping us to focus on our present moment and not worry about all the stressors around us. This can help us to lower our levels of stress. It can also help to regulate our emotions, and physiologically, it can help to calm our body down, such as reducing blood pressure or elevated heart rate, which often comes out in states of stress. Overall, mindfulness helps to set us up for success in responding to the environment around us.
That is really helpful. That's great. Jesse, let's talk about school. Do you have any tips for relieving feelings of stress for kids at school? And what about stress involving peers?
Yeah, I mean, absolutely. I think there's a lot of stressors that can be present at school that we've touched on socially, academically. I think one big one is making sure the child or teen has a support system at school. So a person that's identified, school psychologist, counselor, trusted teacher, safe adult, that they can go to in a moment of crisis that they know knows them and knows how to support them in the ways they can. Having a safe word or a word that you use with friends or with that person that just says, hey, I'm having a hard day. I don't necessarily want to talk about it. I just needed someone to know so I don't feel so alone. Things like that. Teaching kids how to have those conversations and identify.
At what age do you do that?
That's a good question. I mean, my not so simple answer is a case by case basis, but I would say like that's probably more around middle school, 12 or 13, when they have that insight to know that they are struggling and can identify someone else. That's also when they're starting to maybe talk to others more than their parents. So that's a time to have, again, a support system outside of the family. Other things that can reduce stress, like concretely, having, again, the educational accommodations where they maybe are testing in a separate environment. So they're not having to take tests around their peers, feel the anxiety that they're not going to finish on time. Having things at the end of the day to look forward to. I think, everybody could benefit from having ice cream or chocolate, to look forward to the day. So something like that, where it's just something, may seem small, but giving, again, it's future focused and gives that kind of sense of hope that I'm going to make it to the end of the day. So yeah, those are just a few ways.
That's really helpful. Jenny, I'd like to talk about sleep. I know Arthur feels very strongly about sleep. The first time I met Arthur, we talked about sleep, how sleep is something everybody can talk about. It's important to everybody. I'm sure none of us are getting enough sleep, but how much sleep should kids get?
I agree. I think everyone can use a little bit more sleep, myself included. But generally, the recommendation for kids 12 years old or younger is 9 to 11 hours of sleep. And for our teenagers, 8 to 10 hours of sleep. Sleep is incredibly important for our children with mood disorders because adequate sleep is important for emotion regulation. Disruption in sleep is often a first sign that a mood episode can be oncoming,
And a disruption would be too much or too little.
too much. In depression, sometimes we see too much sleep, and then in manic or hypomanic episode, we see too little sleep. And so this is something that's important to keep track of, especially as our teens or kids are entering stressful situation.
And what do healthy sleep habits look like?
Healthy sleep habits involve having a consistent routine at bedtime, roughly around 1 to 2 hours before bedtime, helping our youth and teen to wind down by doing less stimulating and more relaxing activities, such as reading a physical book, taking a shower, and for those who have screen time, using a blue light filter to lower the level of stimulation. And one thing I wanted to touch on with regards to technology use that can be tricky to manage, because it really depends on what our children are exposed to. For instance, social media apps often contain emotionally triggering content because they are sped through an algorithm and are designed to trigger emotions in their user. And so usage of social media should be minimized in general, and especially around calming bedtime routine should be avoided. The other key to healthy habits is having a consistent bedtime, which will help maintain good sleep habits in general.
Thank you. That's really helpful. Greg, research continues to show the negative effects of loneliness on health. The Surgeon General talked to us at our WOW conference about that. I'm wondering, are lonely kids more vulnerable to stress?
Yeah, so lonely kids, just lonely individuals in general, are more prone to stress, depression. We are social creatures, and so the ability to connect is just it's inherent within us to want to be able to meet with others. A number of the teens that I work with, especially if they're going through something more difficult, part of the process is determining who they can connect with to either get advice or at least feel like they can be heard and validated, whether that's family, friends, etc. And I think as time goes on and technology develops, people are having bigger online communities that they're connecting with. And I think we're still trying to figure out how to navigate that piece. But I think in the end, it's just another way for us to connect, to bond with others.
Manal, in times of stress, how can online social media communities be helpful? And how can they be harmful?
Perfect. This was a great segue into the next question. I will say that I'm glad that we're talking about both the benefits or advantages of social media and also the harms associated with social media. So in terms of the advantages of social media, as Greg pointed out, it can give you an access to like-minded community, which you might not have access to in a physical space. It can also be your way of accessing information, especially mental health related information. It can also empower you to take on advocacy and other helpful roles as well. With regards to negative impacts or the impacts that need to be checked a little bit, it is a source of spreading misinformation. How many folks here have doom scrolled, right? Like, so it is,
What's that?
doom scrolling is like you just keep scrolling and looking at emotionally charged content one after another. And, so it can be a thing, and don't do it before bedtime, as Dr. pointed out as well. Also, with regards to, it can also be a source of toxicity and negativity. I don't know if there are any fans of adolescents in the crowd. If you are, raise your hand. It is a new British show that talks about unchecked social media access for children. It also kind of fragments your attention. So those are, and it can also be a way in which children start avoiding, life or aspects of life. So there are benefits and disadvantages associated with social media use.
Wow. Megan, what are some signs that kids and teens are struggling but trying to hide their true feelings?
Yeah, I think unfortunately kids and teens are not always the most forthcoming about how they're feeling and what their emotions are, as I'm sure most parents know. But I think there are some signs that you want to look out for. One being they're more withdrawn. maybe isolating more, avoiding more activities, avoiding friends, avoiding family. Another might be just noting that their mood is more irritable and cranky. And I know that could be normal teen, but I think sometimes our parents will say in clinic, I feel like I'm walking on eggshells around my kid. I can't do anything right. And it's a shift. And that's something that we should take note of. Sometimes depression can really show up more like irritability and anger rather than sadness or tearfulness, especially in kids and teens. Other things to keep an eye out on are changes in academic performance. So maybe your kid's struggling more to keep up with their classes, they're having a harder time concentrating, they're more distracted, feeling like they're falling behind. And lastly, or one other thing to keep an eye out on is engaging in riskier behaviors, maybe potentially using substances or engaging with peers that might be in a rougher crowd. So all things to keep an eye on and to check in with your teen about them if you notice these things.
That's really helpful, Megan. CHAMP focuses on working with the whole family, not just the child. Jesse, I'm wondering why family therapy is helpful.
Yeah, absolutely. I think there's a few different reasons. When we do family therapy here at CHAMP, we do what's called family focused therapy. And so it involves a psychoeducation component for the patient and the family to really get on the same page about the language they're using for mood symptoms. And so what does depressive symptoms look like for the patient? What maybe have they looked like for other family members? How do we understand these symptoms as a family? What are we going to watch out for? How are we going to talk about it? Which leads into the communication piece. We're teaching communication strategies, active listening, reflecting back what you hear, using these communication strategies and practicing them in therapy is crucial, because in the moment that there is stress or maybe there are active mood symptoms, it's going to be a lot harder to implement healthy adaptive communication between family members in those moments. So we're really trying to practice and hone in on those skills in session. And we have them practice outside of session, even when things are going seemingly well too. And then problem solving, teaching the family, when these symptoms do come up or when there are higher levels of stress, the last couple of months, for example, what are we going to do as a family? How do we come together, think about solutions, all come up with different ones, talk about their effectiveness, or maybe what we don't like about them, and then come to one or two or maybe three different options for solutions that we can implement should these symptoms or the stress levels rise.
Really helpful. Jenny, how would a psychiatrist determine whether medication is appropriate for a child undergoing stress and which one to use?
In my perspective, stress is a natural response that a child or any one of us would have towards perceived challenges and demands from our environment. When a child's level of stress outweighs their ability to cope and their resources, symptoms can manifest such as depression or anxiety. As a psychiatrist, there's no medication that I can prescribe specifically for stress. My perspective and approach is to work with the child and family to understand the stress-driven symptoms and work to determine what would be the most helpful in managing them. For instance, for myself specifically, I'm quite conservative when it comes to medication. And what I mean is that when a child comes to me under stress and it's manifesting as anxiety or depression, and if this child has not had therapy before, that would be my first recommendation, as therapy is effective for the treatment of both anxiety and depression. However, if the child is having trouble accessing therapy because they're so depressed they can't get out of bed to go to therapy, or they need some additional support to their therapy, I would speak with the family about medications that can target their depression or their anxiety and collaboratively decide what would make the most sense. Because I can imagine for a lot of families, starting a medication on a child can feel really alarming sometimes. But I really want to take it where the family and the patient is at and see and go at their level of comfort.
That's helpful. Greg, I'm also curious about your thoughts on medication and stress.
Yeah, so I think a big part of the role of psychiatrists is as Dr. Wynn was saying, trying to help a family figure out what is kind of part of the human experience and part of the learning process of dealing with stress and the day-to-day things that can come up with living in this world, versus something that tips into pathological territory. It's extreme. It's causing a lot of distress to the point where someone's level of functioning is starting to decline, and trying to figure out if therapy is the place to start and give it time. If you want to do medication plus therapy at the same time, therapy always leads. And I think that just adds to part of the complexity of what we do, is trying to figure out whether or not that piece is necessary in some cases, especially with a lot of families who are hesitant to go that route with young children and teenagers who, you know, of course, a parent wants their kid to be able to try to figure things out. Sometimes it's just too much going on to be able to do that in a more typical way.
Thank you. Manal, when should parents seek professional help for their kids? And what kind of help should they look for?
Yes, absolutely. So if there are changes in a child's emotions or behaviors, if you are noticing that something is becoming more persistent, it is becoming severe, it is not improving. For example, a lot of us, as you guys have already also pointed out, a lot of us are going to experience sadness for a couple of hours or even for a couple of days. However, if it is going on for weeks, if it is if it is associated with some other symptoms, such as not having enough energy, not having enough motivation, disengaging with activities that you previously enjoyed, slowness in thinking, all of those kind of highlight that, there's need for professional help. And there are many different professionals that you can reach out to. There's pediatricians, you can reach out to for psychologists, psychiatrists, you can reach out to their schools and see school counsel, if school counseling is an option. So reaching out if you are noticing a pattern of something, if there is persistence, if there's severity, and if there is clinical impairment. And clinical impairment means their grades are not, staying up anymore. They're not engaging with their friends anymore. So they're, not doing well in terms of social aspects or academic aspects or even family aspects.
Thank you. You all play such an important role in mental health care in our community. But I have to be honest, I'm really worried about all of you. I don't know how you juggle all of this and take care of yourselves and your families. So I'm sure each of you have so much stress. I'm going to open this question up to the group. How do you manage your work-life balance? Megan, I'm going to start with you. You have the newest baby.
It was actually really nice to go back to work after maternity leave. I'll say that. It is really hard to stay home full time. But I will say, like, something that's unique to this fellowship is that we have a weekly supervision meeting with each other. So it's such a gift to have time to not only discuss cases and patients that we share, but also to like check in on each other and see how everyone's doing. And there have been times where, someone's very stressed out or there's a lot either in their personal life or patient load. So it turns into a little group therapy session for us sometimes as well. And that's been a gift of this fellowship.
That's great. Anyone else? Brett?
Yeah, I was just thinking about that. I make sure I get my workout in, as we discussed before, even if it can cut into my sleep time, but that's part of the balance is where do you put your energy? And then also make sure I leave some time in the evening or on the weekends to see friends to connect socially.
That's great. With that, before we wrap up, I just wanted to announce that all of these fellows will be coming back again for next year. We couldn't be happier. And we are hoping that Dr. Gitlin hires an adult fellow for next year too. Thank you so very much. You guys are the best. With that, we're going to transition and we have a patient that Greg is going to tell us a little bit about. And actually the patient A is in the audience with her family, and we are really proud of the work she's done and that she and her family are here with us today. And Greg's going to tell us a little bit about her.
Yeah, so I've been working with A for a little over a year now, and it's a wonderful family. This is one of those cases where when I see them on my schedule, I feel like I have more energy. I'm excited to see them and hear how things are going, whether there's things that I can help with or just hearing the progress that's been made. She's come a long way the last year in achieving a lot of the goals that she had set for herself. And from my perspective, really is thriving in so many different realms that maybe felt a little distant when we first started working together, but she and her entire family have put in such work to get to where they are now. And so it's an honor to me that they made this video. And it's like I always look forward to continuing to see them on a monthly basis.
That's terrific. Okay, so we're gonna leave the stage and we're gonna play the video now. Thank you so much.
Hi, my name is Equindel Peral. I'm 14 years old in 8th grade, and I've been working with Dr. Barnett for about a year and a half. I came to CHAMP because my family heard that it was good for difficult cases. After 4 hospitalizations, 13 medications, 7 therapists, and 4 psychiatrists, my family didn't know what to do with me. We started with an evaluation where I explained my past and current struggles with anxiety, depression, suicidal thoughts, and social awkwardness. He listened to everything I said and asked questions that made me feel seen, heard, and valued. After only a few sessions with him, I could already see and feel the progress I was making. Before I met Dr. Barnett, I would sit alone at lunch in the library and read books so that I didn't have to talk with anyone. His guidance helped me make new friends that are everything I could ever ask for and more. They value and appreciate all of me, including my mental health challenges. He helped me adjust my meds and gave me helpful ways to deal with my social stress. Soon, I got my diagnoses that I still have today: autism, anxiety, ADHD, and bipolar 2. It made me feel so much better to put a name to the difficulties I had been experiencing for as long as I could remember. And it wouldn't have been possible without the dedication and perseverance of Dr. Barnett and my family. Since then, I have joined Science Olympiad, a science-based competition, Model UN, a mock version of the United Nations, and cross country. I even won awards in Science Olympiad and at a UCLA Model UN conference. With him as my psychiatrist, I have continued to grow and excel in activities I enjoy, not to mention that my family relationships have been immeasurably improved. Thank you, Dr. Barnett and the Max Gray Fund that supports the Child and Adolescent Mood Disorder Program at UCLA for teaching me to be a bendy pencil and changing my life.
Hey, you are a hero. You are a gladiator. You're amazing. Wow. This. It is now my pleasure to invite to the stage Drs. Michael Gitlin, the director of the Adult Mood Disorders Clinic, and Dr. David Miklowitz, director of Max Gray CHAMP, to discuss research initiatives and advances in behavioral health care for mood disorders. First, I want to plug Dr. Miklowitz's book, Living Well with Bipolar Disorder. It's available on Amazon, and it's a very handy guide. So come on, guys. These guys they're fantastic.
Hi, I'm Michael Gitlin. I am honored to be here. Mood disorders have been at the center of my professional life. June will be 46 years that I've run the Mood Disorders Clinic. I know you're doing the arithmetic, and yes, I was 12 when I started. That part's not true, but the 46 years actually is. So having been in the mood disorders world for almost a half a century, I've seen incredible changes. So in my very brief time, let me tell you about the 3 things that I think are cutting edge and the sexiest things we're dealing with in adult mood disorders. First, and you don't have to come to something like this to know about this, is ketamine. Ketamine is a drug that's been around for a while, and about 11, 12 years ago, it was discovered that it could actually treat depression. It had previously been used as an adjunct in anesthesia and pain control and things like that. Its mechanism is completely different from any other prior antidepressant. And now we offer it in the mood clinic. Everybody offers it in town. Of course, this is Los Angeles. It is potentially a drug of abuse, but like many drugs of abuse, it also can have clear therapeutic effects. The question and the problems we have with ketamine are twofold. One, there are two forms of ketamine. There's ketamine, an old generic drug, and there's S-ketamine, marketed as Spravato, a non-generic drug. Ketamine being old and generic, anybody can prescribe it. And there are now all these online ketamine services. And the concern on the part of the FDA, I don't know about the new FDA, but the old FDA, was about, is this being prescribed in a sloppy, unthoughtful way? And I think there are real concerns about that. That shouldn't take away from the fact that ketamine can really be very helpful for a subgroup of depressed patients. The other issue about ketamine that is of note, the fantasy was we'd give people ketamine either intravenously or intranasally. Orally is less good. And you do, let's say, 12 treatments over 8 weeks, and then you'd stop and patients would do fine. Well, it turns out when you stop ketamine, most people don't feel so good. So now we have all these people on chronic, either once a week or once every 2-week ketamine. And there are no data about the use of chronic ketamine. We're all doing it, and we're hoping that there won't be many problems, and we're monitoring that. We again prescribe that in our clinic too. The second area of great note is that of psychedelics. Again, everybody knows that psychedelics are a hot topic. Psilocybin is the psychedelic that's used most commonly. Why psilocybin and not LSD? Two reasons. One, psilocybin takes about 6 hours to do its thing, whereas LSD is 8 to 10, and there's more cost with having therapists there for those extra 2 to 4 hours. And the other thing, for those of us who are a little bit older, LSD is linked forever to the Grateful Dead and Tim Leary. And not a joke, and so for political reasons, it was decided that psilocybin would be the safer choice. There are numbers of studies going on. There's clear evidence that psilocybin helps, again, with a subgroup of people with depression in one treatment or two at the most. It's extraordinary. But the problem is, how do you do research? You do research by comparing an active treatment to something else, typically a placebo in what's called a randomized controlled trial or double-blind trial. How do you make it blind when somebody gets placebo and the other person gets a rip-snorting dose of a psychedelic? Patients are pretty good at guessing which one they got. So blinding patients or subjects in a psilocybin study is not so easy. The other question is, do you need to have psychotherapy? All of the current studies are psilocybin-assisted psychotherapy, it's called, versus placebo. Do we know how? So the idea is that psilocybin facilitates psychotherapy, and in 6 hours you get done what would take you 4 years in another kind of therapy. But we actually don't have enough studies to really know how important that therapy part is. Again, we don't have time to go over the details, but that's a fascinating area. The last thing about psilocybin to say is, especially in San Francisco or the Bay Area, microdosing, where you're using a very low dose of psilocybin on a daily basis as opposed to a full psychedelic dose. There's not a single study about microdosing for depression. So that we don't know about. What we know about is full dose psilocybin. And the last thing I wanted to say is about bipolar disorder, which is something I've worked in for years and years and years. We are thrilled, David Miklowitz and I, and Jen Cruz, who is our principal investigator for our site, to be part of a multi-center study on bipolar disorder. 6 sites across the United States, Mass General, University of Michigan, Mayo Clinic, Hopkins, University of Texas, Houston, and us, and now there are more. The goal is to get 5,000 patients with bipolar disorder and study them incredibly for up to 5 years. There's a basic science component, genetics, neurocognitive testing, neuroimaging, as well as the clinical work that we do. And the best thing about this study is it's funded privately. So no one in Washington can take away our funds. It's funded by a group of wealthy families who've had mood disorders in their family. And so we are immune to the craziness that's coming out of Washington. That is so not a trivial issue in today's world. Anyway, we are thrilled to be part of this. There are 6 original sites. We were one of the 6. We were proud, and I'm equally proud to say that UCLA and Mayo Clinic have enrolled the most people in this study. We're over 100 already in the first year in our study. So we're working on depression, we're working on bipolar disorder, and I look forward to the next half century working in this area. Thank you.
Thank you, Dr. Gitlin. I was feeling pretty good until you mentioned Washington. It's a real pleasure to be here, really exciting for me, actually. This is the 10th year of the Max Gray Fellowships. I've been involved, of course, since the beginning, and it's amazing now to see how much these guys have grown in the last 4 or 5 years, how much more expertise they have, clinical sensitivity. I'm at the point now where I go to them for advice on my patients because things have really changed. So you've heard a lot about clinical strategies, but what are we learning in our research? We also do research in the Max Gray Clinic, and our focus is on families, family relationships. And for a long time, we've found that patients, kids, and adolescents who have mood disorders do much better over time when their families are engaged in treatment. But what does it mean to be engaged in treatment? One of the things we found is that families get very good at recognizing the early warning signs of mania or depression. They can learn to see when the kid is ramping up, so to speak, speaking faster, sleeping less, becoming more irritable, doing grandiose things. Families are now in a position where they can contact the psychiatrist for a change in medications. They can restructure the environment or help the kid restructure the environment to be able to get better sleep, to be able to provide structure at home, to use good family communication so that family doesn't become a stressor, but is more a protective factor. That's one thing we keep finding. But it's also true of depression. We're seeing that many kids withdraw into their rooms, of course, do a lot of video gaming, social media, and sometimes that's really a sign of depression and social anxiety. The family can get very good at learning to negotiate that. You can't just pull the kid out of the room, but you can problem solve and figure out what is reasonable in terms of social media. To what degree can we integrate you back into the family or peer relationships or the things that used to give you joy? This is really a very important part of treatment, which also involves medication, is having the family involved. A new space that we're in, though, is the whole area of what's called metabolic psychiatry, nutrition. And for any of you who are family members, you know that nutrition is a big issue in mental health. I think it's only now, though, that we're recognizing that diet, for example, may play a role in mood stability. A couple of the fellows mentioned the ketogenic study that we've just started. We're now studying a diet, ketogenic being low carbohydrate, high fats, medium levels of protein. There's a theory behind this that it involves insulin resistance. We know that over half of patients with bipolar disorder have problems with insulin resistance, which of course controls how glucose is used in the cells. What a ketogenic diet may do is provide an alternative source of energy in the form of ketones, or what are called ketone bodies, fats, essentially. Sounds counterintuitive. It's different than what we all learned about diet, but we're going to be entering some 60 kids at 4 different sites into a ketogenic trial. We're going to be providing the food. This is also privately funded, by the way. And they're going to be testing their own blood. What we're hoping to be able to show is that over a 16-week period, this is a useful adjunct to medications and psychotherapy and all the other things we do. But of course, this involves family. Family has got to be very critically involved in diet, whether it's a young person or a young adult. And of course, the family is a critical part of our ketogenic diet study as well. So with that, I just want to to give a moment of thanks to, on behalf of myself and also Dr. Gitlin and all of the Max Gray Fellows, to Lori Gordon and Steve Gordon for their incredible vision and inspiration and dedication to our program, without which we wouldn't have been able to do any of this. So thank you very much, Lori. So, thank you all for being here.
Thank you so much. Wow, we have come a long way in 10 years. I'm so proud. I can't even, I'm trying to hold it together. I'd just like to thank everyone again. Thank you, doctors. Your leadership of this program has been terrific. 36 fellowships. Wow. Thank you. I'd also like to thank some of the wonderful staff who help keep our program running every day. Co-director of our Max Gray Champ program, Dr. Patty Walsaw, clinical supervisor, Dr. Elizabeth Horseman. She was a former Max Gray fellow, and our patients coordinators, Georgia and Jake, our tremendous development team who pulled this all together, made it look easy, fed everyone. They're going to get you in and out timely. We're 5 minutes late, but we're working on it. Now, thank you all so much. Now I'd like to ask President Spiso to come up and say a few words about the future of behavioral health care here at UCLA.
Well, thank you, Lori, and congratulations to our fellows and to the whole program for the 10th anniversary. And thank you all for being here tonight, and many of you who support this great program. As Lori mentioned, thanks to the work of our team at UCLA Health and our amazing board of the UCLA Resnick Neuropsychiatric Hospital, many of whom are here, we are expanding our hospital. In 2026. We will open our new Resnick Hospital campus in the Mid-Wilshire area. We'll expand from 74 inpatient psych beds to a total of 119 plus 20 observation, which really means 139 inpatient beds, a dedicated psychiatric crisis receiving area, and a 90,000 square foot outpatient mental health building so that we can expand all of our clinics and our partial hospitalization programs. That project is on time and on budget. It represents a $450 million investment by UCLA Health for one of the most vulnerable populations in Los Angeles, where many of our competitors in the community have really abandoned care for this population. So we couldn't be more excited, and we're just thrilled to be able to retain such talented faculty and staff to take care of our patients and really deliver this evidence-based medicine that truly makes a difference. So thank you all. And again, Lori, congratulations to you and Stephen and Charlie and everyone in your family. And everyone have a great evening. Thank you.
Thank you, Jonice. And many thanks to all of you for spending the evening with us tonight. As most of you know, this program was established to honor the life of our son, Maxie. And Maxie was one of them. Oh, I'm going to try to keep it together. Maxie was one of a kind. He was funny. He was creative. He was smart. Some of his friends and our family are here today. He cared deeply about the people he loved and brought out the best in those around him. I know he would be really proud of what we have created here together over these last 10 years, just like I am. I cannot overstate how appreciative I am to all of you for your support, to our wonderful fellows, to the wonderful leadership in UCLA Health. You make the extraordinary happen every day, and I'm so proud. Thank you, everyone. Please drive home safely. Thank you.